Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about the difference between low-dose immunotherapy and homeopathy. So someone posted a question about this on one of my other videos, and it's a really good question because when you look at some of the features of low-dose immunotherapy and homeopathy, there's definitely some overlap. You know, they're both using diluted formulas, so they're both using diluted substances, I should say, and the nomenclature that's used to describe homeopathic dilutions is actually the same nomenclature that's used to describe LDI dilution. So they all use this nomenclature of a number followed by the capital letter C, C being 100 in Roman numerals, and so you could have a 6C, Calcarea carbonica homeopathic, and you might also have a 6C streptococcus LDI formula. So there's a couple of similarities there. The big differences with homeopathy and low-dose immunotherapy are a couple of them. One is that with homeopathy, and there's different branches of homeopathy, there's different methodologies that are used. In classical homeopathy, you're trying to find a formula that has certain attributes to it that exactly match or very, very closely match the symptom picture of a patient in question, and you try to find that exact right match, and then seemingly through magic it just helps them to feel better in many ways or in all ways. With low-dose immunotherapy, what we're doing instead is using a formula of the substance that is causing the patient problems. So like if a person's having histamine sensitivity issues, we'd use histamine LDI. If they're having issues with the Borrelia burgdorferi bacteria, we'd use Borrelia LDI. If they're having yeast issues, we'd use yeast LDI. So we're using that substance, and we're using it in such a way that is, as best we can tell, desensitizing the patient so they're not overreacting to that substance in a pro-inflammatory way. So if a person is sensitive to yeast, then every time their body encounters yeast, they're going to have a big inflammatory reaction. And that's a big problem because if I have yeast in my gut because I'm a human being. We all have yeast in our guts. And so if I'm allergic to my body's own yeast, I'm going to have this chronic intestinal inflammation. Or if I'm allergic to the streptococcus bacteria, that's also a problem because I naturally have strep growing in my sinuses and in my throat and in my intestinal tract as well, and on my skin and everywhere. And so that could cause sinus issues or gut issues or throat issues or skin issues or other issues as well. So the difference with low-dose immunotherapy is that rather than trying to find that sort of exact right match, this kind of exact magical dose, we're trying to use specific dosages of the LDI to desensitize the immune system, and that's done in a very methodical way. And that's actually where another difference lies between homeopathy and low-dose immunotherapy. With homeopathy, traditionally, homeopathy becomes stronger the more diluted the formula gets. So in other words, if something's been diluted, by a magnitude of 1 with 60 zeros behind it, which would be a 30C homeopathic. So it's very, very dilute. 1 with 60 zeros, I don't know what that number is, but it's very dilute. Then that's not as powerful as, say, a 200C formula, which would be diluted by a magnitude of 1 followed by 400 zeros. So like even like exponentially more dilute. So in homeopathy, it gets stronger the more diluted it is. Whereas with low-dose immunotherapy, the more diluted the substance is, the weaker it is. And that's because in an LDI formula, there are essentially the body parts of these dead microorganisms in the case of, say, yeast or Borrelia. So it's entirely different than a vaccine, but kind of the similarity would be just like in a vaccine, you've got either the dead or essentially the neutered virus or bacteria or whatnot, and that's what's provoking the immune system response. With low-dose immunotherapy, it's also the dead body parts of these microbes, or if it's, say, hormonal LDI, it's diluted estrogen from a compounding pharmacy that's been diluted down, or if it's histamine, it's literally histamine that's been diluted down. Within that, it actually lies another difference with homeopathy, potentially a difference with homeopathy and LDI, where with LDI, when we're using these microbial formulas, they're sourced from a microbiology lab, they're dead microbes, and it's just their body parts that are left over. So they're sterile formulas, but they actually have the diluted body parts of these microbes. Whereas with homeopathy, my understanding is there's differences with different homeopathic pharmacies where some of them are doing that methodology. They have like the the lime bacteria culture and they dilute it down to make homeopathic lime, whereas other compounding or other homeopathic pharmacies, to my understanding, they use kind of like the energetic essence of the lime bacteria. You know, they might put say like a lime bacteria like culture like next to a bottle and shine some light through it and try to like imprint the energetic signature of that formula into the into the bottle, and then use that to then dilute things further, so there'd be more of like a energetic frequency or something like that of the formula in question. So there's different methods out there. I can't really speak to it much, as you might be able to tell. I don't use a lot of homeopathy in my practice. I have seen it work, have some amazing impacts on some patients over the course of time. So I have seen it be clinically helpful, but it's just something I don't use a lot of in my practice. So I don't know all the ins and outs of how the remedies are prepared, but I know that in some cases that is what they do. I just don't know how commonly that's done. So, so that sort of another difference there between LDI and homeopathy is just the manner in which the substances are prepared. So with LDI, it's always coming from a finite substance from, again, compounding pharmacy, microbiology lab, whatever it happens to be. So that would be another difference. So those are a few of the differences between homeopathy and low-dose immunotherapy. There are some other nuanced differences too, but those are the main ones. So if hopefully that answers the question. If there's any clarification around that or questions about anything else, feel free to post in the comment section below, and I hope that was helpful.